Hello, everyone. Hi, my name is Antonella Chierchia. I am the laser therapy consultant at Guy's and St. Thomas's, and I worked there as a researcher for years, developing protocols for the hand therapy department, the diabetic foot clinic, the tissue availability nurses team. I'm still working there as a therapist, and I also take care of the customer care and clinical assistance for Laser UK. So what I want to discuss today with you is what you need to know to install the laser in your clinic. So what exactly are the requirements and what are the things that you must be aware of when you decide to implement a laser in your clinic? So all the practical aspects of running a laser clinic. So let's start from the UK National Regulation for Use of Therapeutic Lasers. Now, I am aware that there are people following this webinar from everywhere around the world. I know that we have people connecting from Australia and from South America. So to all of those, I would just like to say, please make sure that you know what your what the regulation is in your country, and do your research before purchasing a laser so that you are prepared and you can work your regulation in advance. So the regulation that we have here in the UK, it's very simple. So I would just assume that in other countries is very similar. Okay, so first of all, anyone who is fully trained and certified by the laser company can operate the device. Now we have some very important information here. First of all, this means that you don't have to go back to university. You don't have to take courses that will bring you out of your clinic. And this is not really going to take a very long time for you to learn. So the certification as a laser therapist is issued by the company that sells you the laser, according to UK regulation. This is key to understand. Different lasers work in different ways. They have different wavelengths, they have different output powers, they are used in different ways. They elicit different responses in the body. So it doesn't exist one simple course that allows you to be a laser therapist in general, as and make you able to use any kind of lasers on the market. You need to be trained in the specific use of the machine that you purchased. So if you move from a brand to another, you still need to go and to take the course again, because the specifics, the tech specs of every device vary, and they are device specific. This also means that if you are working in a practice with multiple clinicians, all practitioners in your clinic can sit through the course and learn to become a laser therapist, a certified laser therapist, in one go. So this means that you don't have to take time off from your practice. The Core Knowledge course. Now, this is a training course that is defined by UK regulation on the general use of lasers in clinic. This varies from the use of lasers for IPL, for example, air removal, which you have extremely common, and all practitioners that work in the with cosmetic medicine take, and also covers other clinical applications for laser use, such as, for example, tattoo removal. Specifically, obviously, you don't need to know all of that. So the Core Knowledge course that the company that sells you the device is tailored on the use of therapeutic lasers. It's an entire section. Again, it's provided by the laser protection advisors that created the regulation, but you will need to be aware of the Core Knowledge course specific for laser therapy. Ideally, who prescribes the therapy should have a medical scientific background. So this means that you don't necessarily have to be the person who performs the laser treatment. Many clinicians choose to have an assistant or a nurse performing the laser treatment on their patients. But the person who prescribes the therapy and decides which settings to operate on the patient should be someone with a medical training. So your assistant can deliver the treatment, but is not supposed to take clinical decisions on which protocols to use or how long to treat the patient for. You should still monitor your patient. You can see the patient every other week, but the person who takes clinical decision must be the therapist. Now, the laser controlled area, this is the name for the area that is designated for the use of the laser. From a legal point of view, it needs to have certain characteristics. First of all, reflective surfaces should be covered during laser treatment delivery, which means that if you have a mirror in your room, the mirror should be covered. Clinicians typically put a simple blind that they can just pull down over the mirror. Same, obviously, with windows. Of course, you are treating patients, so we all assume that you are already shutting down the blinds for during the treatment. And obviously, the door should be closed as you are performing the laser treatment. A warning sign must be placed out of the door in every treatment room, and every treatment room is defined as laser controlled area and should respect these parameters. Everyone present in the treatment room should be wearing the goggles that came with the device that you purchased. You cannot use other goggles. You cannot use sunglasses. Only the goggles that came with your device can be used during the treatment. This is because different devices, again, emit different wavelengths of light. Therefore, the goggles are specific to every device. So if you use a set of goggles that is from your previous laser, for example, they might not protect you from the wavelengths that you're using with your new device. The laser safety officer is the person in the clinic who is the expert, if you wish, of the management of the machine itself, the therapy itself, and is the person who is legally responsible for the machine and for the laser clinic in your practice. We take extra care in training the laser safety officer, and the person designated as a laser safety officer should be the person to whom everybody using the laser should refer to ask for advice, or if they notice that there is something wrong with the device, or if they have any concern, they should talk with the laser safety officer. And this is also the person responsible for teaching new members of staff how to safely operate the device. Now, as a trainer myself, I strongly advise that you contact the clinic that, the company that sold you the device for training new members of staff. That's because it's so easy over time to maybe forget some details or learn to use the machine in a way that is more personalized and less accurate. So I strongly advise to do so, but it's not mandatory. But the laser safety officer in the clinic is the only person who should train new members of staff. The local rules is a document that the company that sells you the device should provide you, and you should fill it up together. This document describes the points that we saw above, but at the same time, it provides indications that cover They provide information in case of an accident. So, for example, we have to record on the local rules document where is the closest A&E service, what is the personal number of the laser safety officer in case that person is not in clinic on the day. And everyone operating the device must sign this document, certifying that they have taken the training before operating the device. They are aware of the safety measures that they need to operate as they're using the device, and they know what to do in case of an accident. This document must be placed in plain sight in your treatment room or in your office, but it must be on the wall and must be visible by anyone using the laser in the clinic. Now, how is the laser installed in your clinic? Now, different companies offer different installation services. Some companies will just provide you the device, show you how to turn it on and off, and how to move it over the patient. And in about 10 minutes, their training is over and they leave you with the device. This is not the correct way of training a person, a clinician, using the proper medical device on patients. So my advice is, when you are assessing a company and when you are doing your research to understand which laser to buy, ask questions to the company that sells the device. Ask them, how long is the training course? How long is the installation in clinic? What exactly is the procedure for the installation in clinic? Ask these questions and see what they answer. This is a good training course for during the installation. Will normally last 1 day. For example, this is what I do for K-Laser UK. I spend 1 day in clinic where we sit through a couple of hours of training on all the scientific aspects. So we go over the science behind the therapy. We understand exactly what are the biological effects elicited by the laser. And we go thoroughly through the safety procedures for operating the laser. So not only what we need to be aware of as we are performing the treatment, but also how to properly manage the device and proper care that you need to take of the device. What you need to install the device in your clinic is a standard insurance that covers medical equipment. You don't need any extra insurance for the device, nor you need extra insurance as a therapist. Once you are a certified laser therapist, your insurance that you already have is plenty, is enough. The precautions for performing a laser treatment revolve all around eye protection. And this is, again, something that you will find in the core knowledge for when you are trained as a laser therapist. First of all, never point the laser directly to the eyes, even if you are wearing the goggles. This is, again, rather extreme, but still is a precaution. Of course, if you're wearing the goggles, our eyes are protected. But nonetheless, let's be always aware that you are handling a laser, so better to be extra careful. All the people present in the room must be wearing the goggles that came with the device. So let's say that you are treating a child and obviously the parent is with you, or you're treating an elderly person and the carer is with you, or someone who needs a translation and an interpreter. These people can absolutely sit there with you and participate to the treatment, and this is perfectly fine as long as they're wearing goggles. Again, don't use eyewear from other companies, and absolutely do not use sunglasses. Sunglasses do not protect your eyes from laser beams. Again, reflective surfaces should be covered to avoid reflection. So let's say that for a second you're taking off your goggles, but the mirror in your room as not be covered, and you flash the laser around, and the mirror will just do its job. It will reflect the beam back, and it might hit your eyes. So make sure that during the treatment, all shiny surfaces are covered. As you are operating the device, as you're using the device, make sure that you always monitor the device is functioning properly. Now, a good device will tell you if there's something wrong with it. When you are operating a K-laser, it will run a series of diagnostics when you turn it on, and there is constant diagnostics going on as you're using it. And there is a pop-up message that pops up and says, lets you know if there's something wrong with the device that needs your attention. Sometimes, if the damage is extreme for any given reason, maybe the fiber optic is broken, you receive a message that basically says, turn off the device, and the device will actually turn off or won't allow you to be turned on. But be aware that many lasers are not that sophisticated, and therefore they need constant attention. If the laser shows any sign of malfunctioning, do not try to fix it yourself. It's a laser. You need to be an engineer to fix it. So do not try to repair it yourself, and be aware that the warranty will be voided if you try to do so. Only authorized personnel should use the laser in clinic. So only people who have taken the core knowledge training and whose name is registered on the local rules document are authorized to operate the machine. As you are performing the treatment, make sure that the laser in use message is hanging on the door, so that anybody, your assistants or other practitioners, won't just walk in and they are aware that the laser is in use, and that they can't access the room because they're not wearing the goggles. Now, all these points that you need to be aware of are normally discussed with an LPA, a laser protection advisor. This is an expert who comes to your clinic and provides professional assistance in determining the hazards, in assessing the risks, in proposing solutions to make your laser controlled area safe and compliant with national regulation, and that all the procedures are perfectly in place to guarantee the safety of both the operators and your patients. Now, in UK, it is not mandatory to hire a laser protection advisors, but if you want, you can just go online and Google the professionist who is closest to you and have a quote should you want to use their services. Again, a good company that sells lasers is going to provide you with a laser protection advisor. It's the person who actually comes to the clinic to do your training, also assess the room, and make sure that the room is perfectly safe and compliant with national regulation. Now, some precaution about the use of the laser for pregnant women. This is a question that we receive all the time. Can a pregnant woman use the laser as an operator? Yes, absolutely. It is perfectly safe for a pregnant therapist to deliver laser treatments. The laser light, first of all, is non-ionizing, and also obviously is pointed away from the body of the therapist, is pointed towards the patient. And the laser should only be turned on as the head is placed on the body of the patient. So again, it's perfectly safe because the beam is directed to the patient and not to the operator. Any reflected laser beam is blocked by clothing. Now, as we all know, if you walk in the sun and you are the areas that you're covered by your clothes, they're not going to get tanned. It's the same principle. Clothing block light. So a laser beam that is accidentally reflected in the room will not in any way possibly damage the fetus, because the clothes that the therapist is wearing are enough to block the light. Also, the profile, the radiations emitted by a K laser, in particular a K laser, is less than that of a clock radio of a toaster. So it will be just like working next to a toaster all day. You're not going to be affected by the radiations. Now, of course, the benefits of implementing a laser in clinic are several. First of all, is a non-invasive treatment that you can use on every patient, from a child to an elderly person. It's not a painful treatment at all. The sensation that the patient perceives is just warmth in tissues. Sometimes you can feel pins and needles in your limbs because your nerves have never been stimulated this way before, but that's all you feel, warmth and maybe some pins and needles or shooting sensations. Patients with nerve damages might have more intense sensations, but then again, that can be easily addressed by manually adjusting the protocol and making the treatment more gentle. The K laser is safe to use on any skin tone. Not every laser is. Many therapeutic lasers can treat Caucasian patients, but they will shut down certain wavelengths, the wavelengths that are responsible for the overeating, for the eating of the tissues, because they are not equipped to deal with darker skin tones. Now, this is a question you have to ask to the person to the representative that demonstrates the laser you are considering to you. This is something that they tend not to say, so make sure that you ask this question. Can I treat everyone with this laser? Can I treat patients with dark skin tones? If the answer is yes, but mind you that that means that one of the therapeutic wavelengths that they are using is automatically shut down when they are treating the patient that has darker skin tones. This is not the case with the K laser, because the way the laser protocols have been developed are safe for darker skin tones, and all 4 wavelengths, 2, 3, or 4 wavelengths that we are using can be safely used on patients with darker skin tones. Is a safe treatment option, which means that it doesn't induce allergic reactions. It's light, so if your patient can have a walk in the sunshine, they can have laser therapy. It doesn't trigger reactions with medications. We have a precaution about photosensitizing drugs. We make sure that we don't treat patients who have had a steroid injection in the past 7 days. After 7 days, it's perfectly safe to use the K laser and in general laser therapy as a whole. But in medications that are photosensitizing have never shown to have any reaction with infrared light. They only react to UV light, not to infrared light. So because most therapeutic lasers use infrared light, they are perfectly safe to be used with those medications. The benefit to your clinic are obviously multiple. First of all, you are offering, you're getting better clinical results, which obviously means that your patients are happier, because the laser is used in conjunction with your existing treatment techniques. They enhance what you are offering to your patient. They complete your other techniques. They stimulate the tissue at the cellular level whilst you're working on the structures of the body. So it's a more comprehensive treatment that you're providing. As I said, it's suitable for every patient. Even patients who are taking a lot of medications, they can still have laser therapy. Obviously, it increases the number of referrals to your clinic. Once this therapeutic option is available, the word of mouth is really significant. All our clinicians report that purely by word of mouth, they received a much higher number of patients coming through their doors. And because it's a safe treatment option, it allows you to treat those cases that you would have treated before. Very frail patients, children, very sick patients. Obviously, it is also, it generates you revenue, because obviously you are charging for this treatment. Some clinicians decide to simply increase their fee and or offer the laser as a standard of care with every treatment. Other clinicians charge separately. Of course, the laser also distinguishes you from the competition. So laser therapy is not very widely used in the UK. Other countries have used it as a standard of care, but in UK we are still a little behind with that. So having a K laser in particular means that you're offering a treatment that very likely no one else is offering in your catchment area. The implementation, as I said earlier, is very easy. Is something that can be done in a day. The portability is key. Now, certain devices are very large, they're very bulky, and they cannot be moved, not even from a room to another. Other devices like the K laser are just very small. They are the K laser specifically is only 2 kilos in weight, and you can just easily move it from a treatment room to another, but even provide home treatments to those patients who cannot travel all the way to your clinic. So this again increases the opportunities of treating new patients. Is a non-pharmaceutical pain management solution, and therefore doesn't require a prescription, but is extremely effective in managing pain. All my patients at the hand therapy clinic, they all come off analgesics and anti-inflammatories within a couple of weeks of treatments. So laser therapy does not mask the pain. Laser therapy heals. So it's a proper therapy, is a cure. So in cases where you are dealing with chronic pain, is an excellent pain management solution that can be used over time, over and over again, because again, it's light. So it doesn't trigger, it doesn't have negative effects on the body. K-laser offers trials in clinic, in your clinic, and during a trial we spend the whole day together for your training, and we cover the biological effects, the safety, how to correctly deliver the treatment, and how to safely operate the device. We teach you how to correctly deliver the treatment on different patients according to the body part you're treating and the condition you're treating. And we also assist you in treating your own patients. We spend hours going through cases that are the cases that you will actually see on a day-to-day practice. And we shadow you, and we make sure that you are fully confident in operating the device. You have the laser for 3 weeks at your clinic, and when you are just using it the way as you would normally do. And at the end of these 3 clinics, we come back to collect the device, and we have a discussion, and we go through the notes of the patients you treated with the laser together, and we assess how the patients have improved over time. The full trial allows you to have 5 hours CPD credits, because they cover the training course, and it's free of charge. So you can have a free trial at your clinic with 5 hours CPD credits and the whole day of training with K-laser. This obviously is only valid for K-laser. Other companies may not provide this service or may provide different services. Thank you very much for your time, and we will now take questions from you.